and instant credibility adds to her every presentation due to her enormous expertise. From being a critical care staff nurse and an emergency room nurse to being an administrator and now a consultant for the Studer Group. She's interested in creating positive change, a very transformational leader, because she believes today that we all must develop excellent communication skills to lead the transformation of healthcare. Pam has recently completed her doctorate in nursing administration and practice in healthcare systems and leadership. So she's a fellow DNP graduate. She began her career with the Studer Group in 2000 as one of the first coaches for Quint Studer, making her a longtime staff member. Her achievements include coach of kind results that make people like you sit up and listen. She is so interested, and she walks the talk. She raises patient and staff satisfaction in the hospitals that she consults with, and so we're all hopeful that by listening to her today that we can take away pearls of knowledge that will help us do the same. She's also been responsible for reducing turnover and improving quality of care metrics. She's worked with many hospitals of small size and large size and many systems. She was previously a full-time nursing administrator for Sarasota Health Systems at Memorial Healthcare in Florida, and she assisted them in their magnet designation. She thrives on leading teams to day-to-day leadership, as well as working with high-performing partners who she believes in the power of humor and fun will create a positive learning experience. Pam has been described as genuine and a leader who walks the talk. She's especially comfortable with working with folks of all backgrounds and styles as we have here today. She's known for her passionate commitment to nursing and is driven by assisting you, the next generation of leaders for healthcare. She pushes people toward accountability, staff engagement, and patient safety. Pam is especially adept in molding her presentation to anyone, and so we are very privileged and honored to introduce to you Dr. Pam Beitlich.
Thank you, Shiva. Thank you so much. Is this working here? Can you hear me back in the back? It's such an honor to be here this morning. After hearing Regina, I had to go to the bathroom and make sure my mascara wasn't running all down my face. How about you all? What a powerful, powerful story. And part of what I'm going to do today is kind of roll back to that, kind of intertwine that throughout the day. A couple things I just want to make sure. I'd like to see who all is in the audience. I know it's a very diverse audience. Who is in here? Do we have any nursing students? Oh, wow. That is awesome. Oh, that's great. Do we have any, who's working right with our patients right at the bedside? Taking care right? Perfect. Who is in, who's maybe a frontline supervisor? Okay, so we have leadership starting there. How about director level, directors of nursing? How about CNOs? Do we have any CNOs in the audience? Okay, a couple of CNOs. And we have a couple deans in the audience as well. The deans, I know I have at least one, maybe two in the audience. So we have a real spectrum in this audience, all the way from deans of nursing school that are teaching us today, that are taking us into the future. We have brand new students. You're the future of nursing right here in front of us. Did anything she just said to you make any impact on you all? How you're going to do your nursing practice or how you're going to provide care? And then we have some of us in the audience, myself included, that have been in healthcare for many, many years. I've been in healthcare for over 30 years. I'm not going to tell you that's good or bad. I have a lot of experience, but I also have a lot of experience in things that I know I don't ever want to do again. Because when I went to nursing school, we never even barely talked about the patient. I don't know about the rest of you. We would never have talked about the patient experience. I don't think we hardly really talked about communication, if I don't really remember it. We certainly didn't talk that much about quality or nursing-sensitive indicators, all the things that are out there today. We're going to have a little bit of a journey today. We're going to do a little bit of personal reflection, myself included, because as you'll find out, I haven't always been a great nurse, and I haven't always been a great leader. I thought I was, but I really wasn't. I've done some things that I'm really not proud of today at all. We're going to talk about engagement. I'm going to kind of start there and how important engagement in healthcare is today, and how maybe sometimes we get disengaged, we do get burnout. We're going to talk about that a little bit later this afternoon. We're going to talk about the future of nursing, but we're going to start this morning on a little bit of what I'm going to tell you is the tough stuff. We're going to start with having tough conversations and what that really looks like for all of us. We're going to talk about things around conflict. What do you do when you have conflict? What do you do when there's something you see in the workplace that just didn't make sense, even down to the nitty-gritty of someone didn't wash their hands before they took care of a patient? So we're going to talk about all of those things today. Watching Regina, this may be a runaway clicker, so I'm going to see what happens. And if it does run away, I'm going to be standing up here, so we'll see what happens. So as I said, we're going to start here today. We're going to start with kind of getting the hard stuff out first, and then towards the end of the day, we'll be talking about the future and what change is going to really look like. My objectives this morning, and I want you to see there are a couple of goofy pictures in here this morning, and I'll tell you about those. We want to have tough conversations so that we can literally increase engagement, create some safety, and if you don't think tough conversations aren't about safety in healthcare, we're sorely mistaken. Patient safety is such a huge part of healthcare today, and you just heard a classic example. We want to be able to clarify expectations and increase accountability. I think in healthcare today, we don't do a good job of really clarifying what we expect, particularly as leaders. So this is Beth Keene, and I don't know if any of you are familiar with the Studer Group at all, but Beth was one of our original coaches. You heard that I started with the Studer Group in 2000. So for 15 years, I've had 2 jobs. I still work full-time at Sarasota Memorial. I'm going to talk about that in a little bit. And I also work part-time for the Studer Group. Beth was one of the very first coaches. Beth is the one that literally, as we're developing curriculum and really looking at what healthcare needs, Beth said, you know what? I wonder if we as healthcare providers are able to have tough conversations. I wonder if that isn't something we all need to learn a little bit better. So she developed a lot of the curriculum. It will be 2 years now in August. Beth died of breast cancer. And through her story, I'd love to tell you some of the stories she told us as she would email us, let us know how she was doing. But one of the big things that I'll never forget is how she would meet people during the day that would be fabulous care providers. Their communication skills, how they talked to her. But then she said, as you're going to see a little bit later with high, middle, low, she said, but please know there are still some people in healthcare today that really shouldn't be. And we have to continue the push to make sure that they're either coached up or coached out. Oops, here we go. So I think you're right about that. Let's see how this works. So how's your day going? I just want to make sure everybody's awake this morning. If you've seen this picture before, you know that it's one of my favorites. It's just something that, your day could have been worse this morning, all right? I want you to think about that. Some of you may have come in here this morning feeling a little bit like this. You're already having a bad hair day. A lot of things have happened even before you get to work, right? You might be feeling a little bit like this guy. Dr. Jay Kaplan gave me this picture, and I love it, especially living in Florida. I can completely relate to him. You guys might have a bad day like this before you get to work, right? I don't think I'll see this too often in Florida. Oh, by the way, I am a Midwesterner at heart. I grew up in Illinois, a little town called Arthur, Illinois, and really have the Midwest still in my heart. So just wanted to let you all know that. This is my personal favorite. And just to relate it back to the day, at first I thought it was hilarious, and the more I think about it, it really was put up there by a low performer, okay? And we're going to talk about that later today. There is so much change out there today. There is so much ahead of us in healthcare. And for those of you that have worked in it for 30 years like I have, the change has just been unbelievable. It's unrelenting. So we're going to talk through a lot of those pieces today. I do want you to know, though, everything I'm going to talk about, I still work full-time. I'm the Executive Director of Women's and Children's Services at Sarasota Memorial, Sarasota, Florida. Anybody ever been to Sarasota, Florida? Raise your hand. I'll have to keep my stories clean then, because you might know some of the actual names. Just kidding. But we have just been redesignated for the third time as a magnet organization. That was part of my job when I was doing service. I was the initiative champion around patient experience, and then went back into operations with Women's and Children's. Worked there for almost 30 years, and can tell you that the leader that I started out as, or actually the nurse I started out as, has changed a lot over those 30 years. And that's part of where I really want to talk about today. The foundation of everything we do, if you know anything about the Studer Group, we now work with about 850 partners, have about 150 employees, up to 200, have somewhere around 80 coaches and speakers. And we've been out in the field doing it. We know exactly how to get to those results. These are what I would call somewhat of the Bibles that we really live and die by. If you've never read either one of these books, I highly recommend them. They're the kind of book that you can read very quickly, go through it, and you'll laugh, you'll cry, but really brings you back to what I call the kind of the worthwhile work we do every day. Again, if you know anything about the Studer Group, after 15 years of doing this, what we found is the biggest thing that healthcare needs today are leaders. Leaders that have a lot of courage. Leaders that will do the right thing. Leaders that will have tough conversations. That's what we need today. And we essentially have what we call evidence-based leadership. And I don't know about you, but when I first became a leader, it's the whole thing of I was a good charge nurse. And then all of a sudden on Monday I was in charge of a whole unit. And then it went from there. I didn't really get a lot of education or training around leadership. So what we talk about, or I just look at them as three kind of buckets. We feel like you have to know where you're going. You've got to have some goals. And that as whatever organization you work at, that you all know where you're going, what your goals are. And you have to have some objective way of measuring those. Then you have to be developing your leaders. I've been in hospitals today, and I don't want to make any judgments about the hospital where your husband was, Regina, but I believe there might have been somewhat of a lack of leadership in that whole organization. I feel like we failed you and your husband, your whole family, on so many, many, many different levels. Great hospitals, great healthcare organizations today have great leaders, and we have to figure out how to get you the skills that you need, because it's a whole new skill set today for leaders. It's not the one I had when I first started. Then in the middle we have, I like to talk about this in the middle as the culture of your organization. What do the behaviors really look like in your organization? Under the must-haves, we have such things as rounding, thank you notes, a culture of recognition. We talk about peer interviewing and how you have to ask your staff to help you hire the people they're going to work with, because you're going to get a much better hire. I don't know about you, but when I've hired people that, nurses, for example, when I used to hire nurses by myself, they interview very differently with the boss than they do with the people they're going to work with. Literally, I was so bad at it that 2 weeks after I'd hire a nurse, other nurses would come knock on my door and say, so where do you get these people? Seriously. I mean, I wasn't good at it. Today we know in healthcare if you want to hire a great nurse, we ask the people that are going to work with them. Now, you can't have the low performers interviewing them, and we'll talk about that a little bit later. The other must-haves then go along with something we call discharge, pre- and post-discharge phone calls. And in those phone calls, they started out in 2000 as a little bit of an empathy thing where you made a connection and you called the patient and said, hello, my name's Pam, I was your nurse, I discharged you yesterday, just thinking about you today, wondered how you're doing. Today, all of that's gone. Today, the University of Alabama, Oklahoma University, all of the, particularly the academic centers that we work with, are looking at discharge phone calls as literally the standard of care. Because what we know today is with transitions of care, it's one other way of making sure that your patient, once you discharge them, doesn't have some adverse event. And why is that? Because as we talk about readmissions and readmitting somebody within 30 days to your hospital, guess what? You're not going to get paid for that. So many things have changed. In my opinion, discharge phone calls are now a standard of care. If you're not doing them in your organization, I would ask you to really consider it. The last one of the must-haves is what we call keywords at key times. I'm going to talk a little bit about those today. And if you didn't just get the message from Regina of how words matter and how words make a difference, or the avoid of words, if you will, how important that becomes in patient safety, really in everything. The final part, the middle part in behavior is what we call performance management, and that's all around high, solid, low conversations. So you're going to see how that kind of works today. And then lastly, we know that in healthcare, we have to be looking at our processes. The government is telling us they're going to pay us more if we become more efficient, because we all know there's waste in healthcare. We take 20 steps to do something which could probably it could be done in 5. We know that we keep people in an organization that really aren't high performers, and they cause waste. I'm going to show you a few of those examples. We know that whether you're doing Lean, Six Sigma, whatever it is, all of that is so important in healthcare today. This kind of goes back and forth, though. It's not completely linear. What I do know is if you don't have your leaders involved and have great leaders, you're never going to have a great culture. Never, ever, ever. Particularly if your leaders don't role model those behaviors. And lastly, if your leaders haven't been brought in and be part of your Lean, Six Sigma, all the efficiency you're trying to do, none of this will stick. None of it. So in healthcare, we've kind of compartmentalized things. Today, all of this has to be there. Is it tough? Absolutely. I'm not going to say it's tough. It's just interesting. How's that? Challenging. I always start every organization, and I just threw in USI's, your mission. I think everything and anything starts with your mission and who you are as an organization. So if you're from a hospital, I would always start with what your mission looks like. I like how you talk about comprehensive outreach programs. We prepare individuals to live wisely in a diverse and global community. Your vision is very simple. Love it. Shaping the future through learning and innovation. Such a simple vision. And one thing I will say throughout this day, I will hope that all of you can walk out of here today with something that you've learned, something that you can walk out with that will help you be a better nurse, a better student, a better leader. Certainly our mission very much aligns with what you just saw. Our mission at the Studer Group, to me, is extremely compelling. We want to make healthcare a better place. And you're going to hear throughout today where I contributed to not making healthcare a great place. To me, it's so simple that if you hire the right people, you have people that are very engaged and really want to be there in your organization, in their jobs, you will get great patient care, and your physicians will only want to bring those patients to you. I believe in my heart of hearts it starts with whether or not we really want to be there and how engaged each one of us are. You're going to hear a lot about change today, particularly towards the end. I don't know if you remember, but Albert Einstein said the definition of madness, or the definition of insanity, is doing the same thing over and over and over again and expecting different results. So, just like you're standing here or looking at me today, I have about 12, 15 extra pounds on that I think about it a lot, exercising in the morning. I can visualize it. I can see it. I can see myself doing it and getting back in shape again and being healthy. I just can't execute. And you're going to hear us talk about execution today as well. I don't really like that term in healthcare, execution, but we're going to talk about how do you get this done. So part of today is if you want to just stay where you are and have the very same results, then don't change anything. But just remember, there's some pearls I hope you'll hear in here today that if you want to be better, and I don't know exactly the reasons that you're here today or your own goals or what you'd like to learn, but you got to change something. And even if you heard it today, doesn't mean you're going to go back and do it. Just knowing that if I got up this morning and walked 2 miles like I used to will decrease my blood pressure, keep these 10 pounds off, I still didn't pop into doing. Okay, that's a key thing I want you to remember today. So let's start with engagement. You've already heard me use that word. Gallup talks a lot about engagement. Those words are everywhere today with our healthcare workers, but not only healthcare workers, but workers across the United States. Are they engaged? Do they really like what they do anymore? I like Gallup because they are so deeply entrenched in so many things in terms of research. But if you'll notice, what they tell us is engage. There's 2 words up there. Work with passion and feel a profound connection. There's that word connection. And I'm going to ask you in the audience, every single one of you today, how connected do you feel to your work today? And are you still passionate when you get up in the morning and you drive to your job? Are you still passionate about being there? In the middle there is kind of not engaged, essentially checked out. What I want you to know is I didn't realize it, but that's where I was as a leader. I just didn't even really know it. I hadn't moved into actively disengaged, and these are people that are unhappy and actively acting it out every single day. Here's part of what happens in healthcare today. And if you just get to the patient experience, if you just get to patient safety, it doesn't really matter. But if you've got primarily high and solid performers, but you leave these actively disengaged low performers in the workplace, they can absolutely undo everything that the high and solid performers did. And if you're a high or a solid performer, it's extremely frustrating to have to, because why? What do we have to do? We have to clean up their mess. Would you all agree with that? Now let's talk again about efficiency in healthcare. What a waste of time. It's a complete waste of everyone's time. So a few years ago, when I met Quint Studer in 1999, I was already a leader at Sarasota Memorial. I really thought I was a great leader. And meeting him, how many of you have ever heard Quint speak? If you ever get to know him at all, we call it Studer years, because I learned more from him in 6 months than I had learned from any leader in literally 10 years. He is relentless in pushing you. He is relentless in holding up the mirror and saying, you might want to look at yourself here, Pam. Why don't you look at yourself? No one had ever really done that to me. So he came to Sarasota Memorial, and literally after only walking around knowing him for about an hour and a half in our organization, he said, true story, I couldn't make this up, he said, so did you know you really complain a lot? I said, what do you mean? He goes, I've only been here an hour and a half, 2 hours, and all you've done is talked about how bad it sucks here. Suck is a clinical term, just so you all know. It's a pulmonary, suck in on your spirometer. So he said, all you've talked about is how bad Sarasota Memorial sucks. He goes, you've just gone on and on and on. He said, you are such a victim. Do you know that? I said, what are you talking about? He goes, well, I don't know. I'm just amazed that you're a leader here. He goes, I think I'm already kind of seeing why you guys aren't doing real well. And then he said, I got to ask you a question. When you go home at night, do you ever talk about how bad it is here at the hospital? Like at the dinner table, in front of your 3 children. I have 3 children. When I first started working with Quint, I have let's see, Brady was probably 11 or 12, my son, and I have twin daughters. That's why I've kept 2 jobs so I can travel. I leave them at home with my husband. No, I'm just kidding. But over the years, they were about 8 when I first started working with the Studer Group. So he said, if you go home at night and talk about it, and I said, maybe. And I remember thinking, how does he know this? And these are the key words. Many of you have heard me say this, but it really hit me. He said, I just want to let you know that we're kind of struggling in healthcare today with getting really good people to work in healthcare. So I just want to let you know that you personally are contributing to the shortage of healthcare workers in the future. Why would any of your children want to go into healthcare? And oh, by the way, Pam, you're not getting any younger. I don't know who's going to take care of you if you're not going to help recruit good people into healthcare. And it was have you ever had somebody kind of hit you on the head and go, this is what he then said. Why don't you just get out of healthcare if you don't like it? Because why don't you go be passionate about something? Go do something different. It really caused me at that very moment. It's kind of one of those life-altering things that you go, okay, I either need to really come back to being connected, or I do need to get out of this. Because I was making it worse. I had people following me, and I was not engaged. Can you imagine? For any of you that have a leader in the room that you don't feel they're engaged, I feel guilty of how some of the things I actually did and how I talked, how I acted, how I behaved in front of those that I was leading. So what is the definition of engagement? According to Gallup, that you're willing to invest discretionary effort. You're going to go do something because it's the right thing to do without even being asked. You want to work for this employer for the foreseeable future. You're inspired by his or her hospital or wherever you work in healthcare, that it's really doing the right things and you love being there. I will tell you that one of the many reasons I have not left Sarasota Memorial is for all of these things. I've still been very inspired by the organization. We've grown and grown and grown. It would be hard for me to walk into an organization today that didn't have all the things that I feel about my hospital. Do you hear that? It's my hospital. Then for those of you that are leaders, this is what Gallup tells us about engaging leaders, and I already told you I was not one. I wasn't. They communicate. They communicate. They're very intentional about their communications. They communicate to the team and to individuals for accountability. They have clear expectations, which is what we're going to talk about today. They give praise and constructive feedback, and they are always constantly developing their team. And I like the one at the bottom. They're very accessible. They're informed. They're responsive. You can ask them anything, anything. Because leaders need to be a safe place to go to be able to get information. That wasn't me. I would literally have staff come to me and ask me a question. I would look at them and go, well, how should I know that? Well, you're a leader here. Leaders have to be informed. Leaders have to give their staff hope that things are going to be better. Love, love, love this quote. How are we doing as leaders? 35% of U.S. workers would forego a substantial pay raise to see their direct supervisor fired. I'm almost positive that the staff that I was leading in 1999 would have said that. And that, to me, is humbling. That's very humbling. They'd give up a pay raise. And some of you may even be sitting here thinking, yep, I got a leader like that. I'd definitely give up my pay raise if they'd get rid of him or her. So as you can see, disengagement is fairly rampant. And I'm not saying that disengagement's a terrible thing if you're selling cars, but we are in the healthcare business. Actually, I've met car salesmen that are a lot more engaged than some of the people I've met in healthcare. Would you all agree with that? So here's one message I want you to walk out of here with today. Everybody thinks of changing the world, but they don't think of changing themselves. This was me to a T. And this is no reflection on anyone in the room, because I don't think there's assigned seating, but there could be. I would always, always come 10, 15 minutes late. And I would always sit in the back of anything. I would sit in the back or top of the auditorium in our hospital where it's real dark, and I'd bring in a stack of mail, and I'd decide within 5 minutes if I was even going to listen to whoever was talking. Did they really have anything they could teach me? Because after all, what did I need to be taught? And then, as the speaker might be talking, I might scan in for just a minute, but then I would think, oh, wow, that's actually pretty good stuff. I'm so glad Regina's here so she can hear that. Regina needs to hear that. It was never about me. Today, it's all about me. These are my kids since they've grown up from the last 15 years of working, that I've worked at the Studer Group. And they literally have, I had to change my whole mindset. All three of my kids did all of their volunteer work at our hospital, to the point that my son in the middle there, who was kind of wasn't paying attention, when he started transporting patients, bringing them back up from the OR, he's 14 years old, he would call me on my cell phone and go, Mom, I just brought this patient back up, Mrs. Byler, and she doesn't have any family here at all, and she's really hungry, but the nurse said they probably won't have anything for her to eat for hours. Would you mind if I went and used my own money and got her a sandwich? Oh, I think that'd be great. You talk about what he wrote in his mission statement when he went to get his master's degree. All three of my kids are in healthcare today in some form or some fashion. I like to think that I'm contributing to the future of healthcare. My daughter over here had to be in the ER at school, and literally she's heard me talk so much about this now. She called me from the ER. She's the patient. She goes, "Mom, I just got to let you know, these nurses suck." She said, "Why do we still have nurses that do not want to be here? Why? Tell me why." I said, "I'm doing my best to get them all out, believe me." So that connection thing, and this all makes sense, I promise, in terms of tough conversations, high, solid, low. In today's healthcare environment, we have got to stay inspired and engaged. You have to. You have to always bring it back to purpose. Why am I doing this? You ask yourself that question in the morning sometimes. Tell me again, why am I doing this? After you just saw some of those pictures of how hard it is even to get to work. Connection. Am I still connected? Behavior becomes so important. This is just a quick clip out of USA Today, but they talk about as long as they're good at their job, should rude and unprofessional coworkers be tolerated? Almost 85% said no. And in healthcare, that's even more important. You just heard from Regina's story. Can you even imagine how you treat someone in pain? Can you even imagine letting that diagnosis going for so long? Healthcare is so different in terms of that empathetic worker. So standards of behavior we've seen in some of the very best organizations. If you don't have them, I would tell you, I think to me they're foundational. You really have to lay out today in healthcare how we expect people to behave. Just the bottom line, end of story. We incorporated into the hiring process yearly evaluations every single year. In our organizations, and I would say 95% of our partners, not that you put them in place to fire people, but they are based on every year looking at part of their evaluation as well as how you coach. This is from one of our partners in Lafayette, Louisiana, of all places. But they've taken their standards and really made them real. I ask hospitals all across the country, do you have any policy around people making personal phone calls? And everyone says, yes, yes, yes. My next question is, and do they make personal phone calls in front of the patient, and what happens? Nothing. Just want you to know that's a leadership issue. And please also know, if I am ever a patient in one of your organizations, if I am a patient or my mother or Regina or Freddie, and you get a personal phone call while you're taking care of me, I promise you, I will be having a tough conversation with you, my caregiver, even if I'm the patient. Number one thing, even after anything else, is that it takes us about 20 minutes after we're interrupted to get back to the level of concentration we had before. I don't want you making a personal phone call when I want you to be very focused on my safety. This next one, this is actually their CEO's name's Dave Calicod. He said it took him a very long time to find somebody shorter than him to take this picture, because he is pretty short. But what he's really said, this is the third hospital where he's been a CEO. And when he walks in, he's walked into 3 different hospitals that were absolutely struggling. They were not doing well financially. They've lost patient volumes, all kinds of things. All 3 of them, especially this last one in Lafayette, they now have had to build a brand new surgical center. They're getting so much volume, all these patients back. And what he'll tell you is he always starts here. It's all about how we behave and how we treat each other. And in healthcare today, I just feel it's one of the most important things. What's also really scary is right there at that bedside, right there at that critical interaction, we see some of the most disengaged employees, some of the least disengaged. Now, I want you to know that I've been criticized all across the country I've had nurses tell me, I find that picture so offensive. Really? Get over it. You want to know why? Not that we still have caps on today, but do we ever have nurses that walk into a room and have this expression? You bet. And right on here it says Nurse Crabby. But here's where I'm going to take it a step further. For the leaders in the room, or actually even the peers in the room, I'm kind of done with all of it today. Have you ever been in a hospital? I've been in so many hospitals where I walk in and I may have just met a nurse down in the ER. And that nurse was unbelievably rude. Just rude. Right down, flat out rude. And as I go upstairs and maybe talk to the CNO or talk to the director of that area, and I'll say, you know, this is, just want to let you know, but I already met somebody down your ER, and ooh, she's a little crusty around the edges. As a matter of fact, she was downright rude. And they look at me and say, oh, yeah, you met Cindy. Had it happen 20 times. And this is what they follow with. She, you know, that's just Cindy, but she has excellent clinical skills. She's excellent. She's so competent. Guess what? I don't care. Because you know what? Today, and for everybody, you're brand new nurses starting out, we expect you to hire competent people. And yeah, then I get, well, they've got 20 years of experience. They've got 30 years of experience. And we're going to talk about novice to expert later. Do I think some of that counts? Absolutely. Do I think it ever excuses this? No. Absolutely not. We're going to talk about everything from lateral violence and bullying. This is the face of a bully in healthcare today. There is no place for a bully anywhere today. We say this all the time to the student group. What we permit, we promote. If you walk past something, you walk past somebody on their phone talking in front of a patient, particularly if you're a leader, don't even think that that's ever going to stop. It's never going to stop. If you've allowed it to happen, you basically said it was okay. Part of my message today is we all need to stop making excuses. We make excuses for other people that we work with. Oh, well, you know, they're really busy. You know, that's just how she is. I don't care. And I have to stop making excuses for myself as well. Because guess what? I have a boss that holds me extremely accountable. Extremely accountable. The expectations I have today are crystal clear, both at Sarasota Memorial and at the Studer Group. Nobody makes excuses for me today. Why? Because in my opinion, one of the best ways to make healthcare better is that let's just use the term FTE, we can't afford to waste an FTE today. Everybody needs to be productive, maybe not 100% every single day, but everybody needs to be carrying their own. Everybody's got to stay connected and find that engagement themselves. We know now that there's a huge link between employee engagement and safety. This was from, I told you we work with the University of Alabama, and they've done some studies. How about this? Employees with low engagement are more likely to work around our safety protocols. They're more likely to do workarounds and keep our patients unsafe. So not only are they low performers and their behavior sucks, they're going to kill our patients. I want you to remember that. Actively engaged staff promote a culture of safety, accountability, and they're very transparent. And again, this is from UAB. It is just something that I want you to remember this point. Low performers also are unsafe. And I believe this from the bottom of my heart. All right, we're going to get into a little bit around tough conversations now. But part of why I started with engagement is that you can't have tough conversations unless you're really engaged yourself. You can't have tough conversations. You can't have high, solid, low conversations if you're a leader unless you're really connected and really wanting to make this better. Because today in healthcare, it's not, I don't know about you guys, but when I was in nursing school, it was kind of just about me. I just did my thing, and I really didn't kind of look at my peers or really think about it. Today, it's all about working together as a team, and that we all have to have each other's back. Does that make sense? Because we're all humans. The Joint Commission tells us the reasons that we have sentinel events, the number one is communication. And generally lack of, that we have some kind of a handover or handoff. Anybody think anything was lacking with Freddie's care in terms of things that were not being communicated there? Look at the second one. Leadership. Leadership. Leadership today in healthcare is more important than anything I have at any other time I've ever seen. Again, from the Joint Commission 2002, handoffs, miscommunication as we hand things off, whether it's some missed piece of information. And for you as new nurses down here, I absolutely believe it. We can delay treatment. We can extend a stay. We can kill people by not giving all the information in a handoff. Miscommunication costs lives and money. Innocent miscommunications can account for almost 100,000 people dying. And here I've got Regina here, and I'm sure she's seen all these statistics before. But really, if you think about this, it is so frightening to me that you can come into a hospital where the public and society trusts us as nurses, as caregivers, that we're going to take care of them, and they leave either worse off or we kill them while they're there. Hospital-acquired conditions. It's maddening to think about it. We all know it can happen, but today we've seen over and over that it doesn't have to. So when we get into tough conversations, what's your style with conflict? I just want you to kind of think about it a little bit. Will you avoid it at all costs? I'm going to run away from that. That feels a little too icky to me. It's a little, I got to go. Got to go. Are you somebody that immediately accommodates the other party or whatever it is? Sure, whatever you want. Do you find that coming out of your mouth? Whatever you want. Are you a compromiser that you immediately say, well, let me meet you halfway here. What can we do? There's nothing wrong with compromising, although I personally feel like you're still not going to really get always the best answer, if you will. Are you somebody that just wants what you want, period? You compete. I am here, and I'm going to win. I'm going to win this argument, and I'm going to get what I want. I don't know. Is that you or not? Where we want to be today is collaborating. And in healthcare today, if we can't collaborate, again, we're going to really be wasting resources. I want you to remember that whole idea of wasting resources. Man, I thought maybe it would work. All right, so why don't we speak up? In healthcare, there's a couple reasons. I think number one, we don't know how. We absolutely were never really taught. I think we're afraid of speaking up, but I also think in healthcare, we see speaking up as criticism. And who am I to criticize my peer? Who am I to ask the physician not to give this medication that the dosage might be way too high? Those were the days. How many of you have been nurses for 25 years, 30 years, 25? How many of you would say that's how oh my word, back in the day, it was very scary to ever challenge anything. Those days are over. Write this down. Those days are over. Some of the things that we happen to let some of the common feedback, sometimes we let too much time go by, and as you walk by something or you were uncomfortable, have you ever had that thing of, I'm sure that'll never happen again, so I'll just not. And how often does that never happen again? Generally it does. But then sometimes even with your kids or your husband, well, I should have talked to him about it 3 days ago. It's too late now. Some of these things, as you see up here, and here's one that I really want to get down to, giving a softened form of expectations and not indicating what's going to happen in terms of consequences. We're going to talk about all of that today. So why is it important to address behavior in healthcare? First of all, it breaks down trust. It takes our focus off the job. It can absolutely impact job satisfaction. If you have just been yelled at or if you just had some kind of experience in your workplace, I don't know about you, but sometimes it can take a little bit of time to get back to being able to focus back on taking care of that patient. Would any of you agree with that? It is a very unsafe thing to have in the workplace environment today. Now, this isn't going to be easy, so I just want you, with your partner, just really, really quickly, I don't want to just be a talking head up here. I want you to talk with your partner for literally 2 minutes. What are a couple things that you might see in a hospital today that might feel troublesome? 2 minutes. And I'm going to bring you right back in 2 minutes, okay? couple things. Just yell them out. Anybody? Anything you might see in healthcare today that are troublesome? Anybody? One thing. Attitudes. Bullying. We're going to talk about that. Absolutely. We're going to talk about what it looks like. What? The blame game. We blame each other. Oh, absolutely. Well, I'm really sorry this happened, but the ER does this every day. Oh, thanks. I feel better now as the patient. Yes, absolutely. What else? Gossiping. Do we gossip in nursing? Okay, I'm going to put a line in the sand today. This is Amnesty Day. And I want everyone in this room to know talking about your peers is a personal choice that you have 100% control over. And if you contribute to it, if you do part of it, we're going to talk about what's called sending the mail to the wrong address. You're talking about somebody instead of to somebody, then every single one of us in this room are not doing a thing to advance the profession of nursing. And I want you to walk out of here today and feel that level of responsibility. Have I done it? 1,000 times. Am I proud of it today? No. Do I feel like every single person has a responsibility to shut it down? Absolutely. So we're going to talk about that. That was a great one. What else? Gossiping, blame, bullying. When staff say we're short-staffed right outside the patient room, sometimes we just tell the patient, I just want you to know, we're short-staffed today. I did that all the time, always. Because what I'm really telling the patient is what? Don't expect much. Should have brought your own nurse. You might want to go over to our competition because you're not safe here. You're not safe here is basically what we're saying. Shame on us. Shame on me for saying that to a patient. Are we busy today? Yeah. And guess what? I tell our staff all the time, we want to be busy. There are hospitals in this country that would kill to be busy. But as nurses, what do? Oh my God, we're so busy. Oh my God. Oh, we're unsafe. We're unsafe. I have a thing, do not play the safety card with me, ever, unless you absolutely mean it. Are we busy? Did we just get 3 admissions and things are crazy right now? Absolutely. Can we all pull together and figure this out? You bet. Is there going to be a lull in about another hour? And we're all going to be fine again and our hair's not going to be on fire? You bet. But that takes leaders to help pull people out of the chandeliers and pull people back and say, okay, I'm here right now. What can I do to help? You know, I don't know about y'all, but I used to round, when I rounded 100 years ago, I would walk out to nursing units and say, so do we have enough staff today? Everybody good? That is the wrong way to round. Have you ever heard a nurse ever say, oh, you know, I think we got too much staff. You might want to send some of these people home because, I don't think we're going to need them. Until we have 1-to-1 staffing rate patient to nurse, we're always going to say we need more nurses. Would you all agree with that? And just FYI, there are vacancies and turnover all over this country. All the way up to Canada. We do a lot of work up in Canada. And guess what? They work through it. And they don't tell their patients we're short-staffed. Because they're better than that. Don't be like me. I sucked. And I'm not proud of it. All right, those were all great examples. Great examples. So we all know when we see behavior, you all know it. These are some of the things you already talked about right here. We all know it. So why don't we do anything about it? I'm not sure. I'm not sure. And I'm not going to tell you at all that it's easy. I'm not going to tell you that healthcare hasn't been absolutely, it's our culture. We have bred this forever. We've had, I like to say, dirty little secrets before everything came out from Don Berwick and all of the To Err Is Human and how many patients we kill. We all knew that. We all knew it, but we didn't talk about it. We weren't transparent, where today, just like you heard Regina, it's on the website. We know everything about you. And let me tell you, if you're a patient, That's phenomenal. And every one of you, I would almost bet, are going to be a patient or a healthcare consumer at some point. Would you all agree with that? And I have been recently, and so have my family. Believe me, that's what we want. This is what I believe, and I'm not going to tell you that it's easy, but I think we can all have professional conversations with each other. I think we can all respectfully, not call each other out, but we can respectfully work together as a team and say, whoa, come back, come back. And I believe today, I've seen it over and over and over and over. Leaders, the best leaders, are the ones that can have tough conversations. The best leaders are the ones that can call something out, call behavior out in a respectful fashion. And if you're a leader sitting in this room and you hate conflict and you can't possibly do this, then let me say this clearly. Either get better at it or you're not going to move your results. You're not going to get better. And in healthcare today, being a leader is all about moving results and getting better. It's all about never having a Freddie that ever walks through what she just went through. It's mortifying. It's so humbling to have to hear that. We failed. Love this from Dr. Hickson. We've worked a lot with Vanderbilt along the lines of disruptive behavior, bullying. It actually started about 10 years ago, so he's got a longitudinal study now of disruptive behavior among physicians. Because all of us sitting in the room know we've got disruptive physicians, don't we? Yes, we do. What we also know today, though, is it's not just physicians. It can be all about us as well. Really anybody. It can be the transporter. So the best way you honor people who do the right thing. It's so true. So today, we're going to be a little more personal, like I said. I want you to kind of look at yourself, take ownership. How am I contributing to the problem? And let me give you an example of that. Our chief nursing officer at Sarasota Memorial, we used to have a culture very much of we would run to the CNO and I would complain about my peer. And then the CNO would run to my peer and say, well, this is the feedback I've gotten. And 9 times out of 10, my peer is going to know it was from me, right? Because they knew the exact whatever it was. So what is my peer feeling right away? Why didn't she just come to me, right? So part of what we ask and our shared expectation of our team and with our CNO is if I run to the CNO to Jan Mock and say, well, let me tell you what Connie did. Her first response is going to be, well, how'd that conversation go with Connie when you had it? Instead of, oh, let me listen and go talk to Connie. Do y'all see what I'm saying there? We have to all say, how am I contributing to this? Because if she keeps doing that, I'm going to keep going to her, right? Instead of having that professional peer-to-peer conversation with her. The other thing I would really tell you is we always have to go into any conversation with assuming good intentions. Even if you've had a bad interaction with that person before, you always have to come to every conversation with, okay, I'm starting fresh. And whatever the reaction is, it's not about you. So effective leaders, if you're a leader in the room, one of the biggest things that we will tell you over and over at Student Group is you have to learn how to coach others. You have to develop their skill set so that everyone's performance is constantly moving, that we're all getting better. Because if we're not getting better, we're standing still. And if you're standing still, you're not going to make it today. Your competitors are going to blow your doors away. You may even be a hospital. There's some in the United States that are shutting down. You have to be able to get better. So basic concepts when we're having these tough conversations, why, what's the why? Who's your audience? You want to keep it very simple, very simple. I'm all about simple, man. Mainly because I can't remember too much. I don't know about you guys. The day I turned 40, I couldn't see. The day I turned 50, I can't remember anything. So you also want to think about these other things, your words, your body language. We're going to practice a couple of these. Here's the basic concept. I've got your back. I've got your back. Not this is criticism. This is how are we going to hold each other accountable. All right. So now we're going to talk about how courageous these conversations are. And I'm just going to say that every single one of you in this room have to be a leader today in healthcare. Whether you're a brand new nurse or whatever your role is, it doesn't matter. If you have a connection and you're passionate about what you do and you want to make healthcare better, then you've got to have some courage to have these conversations. We know there's study after study. This is one of the most iconic ones, silence kills. And look at how we don't speak up in healthcare. So as Freddie was having all of that happen to him, nobody was saying anything about it. Nothing was happening. Again, we failed on so many levels. What you permit, you promoted. This is from Vanderbilt, and this is what they came up with at the beginning of kind of what those disruptive behaviors look like. Prevent or interfere with an individual or group's work or performance ability to achieve the intended outcomes. Look at a couple things they have there. Intentionally ignoring questions, not returning phone calls, publicly criticizing other members of the team or the institution, an intimidating, hostile, offensive, unsafe, threatening, intimidating workplace. I just recently took the board certification for, I can't even talk right now, Nurse Executive Advanced. I got to put my initials up there. NEABC is what it's called. But anyway, one of the biggest things in the nurse exec, some of the things that I really focused in on, a lot of the questions were around, what do you do in an environment with intimidating behavior? And the answers, I always got them wrong. Because I started with coaching and like we always do. What the what the book actually said, if you will, the latest resources are saying there absolutely has to be zero tolerance for this stuff going on in the workplace. Are we there yet? No. Do we need to be there? You bet. Because there is what I can't stand that term of we eat our young. I hate that term. But do you all think we do? Absolutely. It's almost like hazing in healthcare. I don't know why we do that. And for you all starting, I'm mortified of some of the things I've said to brand new nurses. I can still recall, here I am in the Midwest, I can still recall vividly working in the ER, and we had a brand new nurse from Ohio State University. We didn't have very many BSNs back then, and I know you all are very much geared towards BSNs as well. One of our clinical coordinators just told me today that 6 years ago in our own hospital in Sarasota, Florida, our own hospital, she floated to a different unit, and she has a BSN, and her ID said BSN. The charge nurse on the floor said, as she walked up and they started giving assignments and taking report, the charge nurse said, "Ladies and gentlemen, we have a BSN in our presence." True story. My hospital. That's just gross. There's no other word for it. So as I'm working with this brand new nurse from Ohio State University, she happened to throw some kind of idea out, and I don't remember what it was now. I have no idea. But she said, well, you know, at the Ohio State University, this is how we did it there. And what did I do? I looked at her and I said, well, then why don't you go back to the Ohio State University and do it there again? If any of you have ever said anything like that, again, this is Amnesty Day. There's no other business in the world, no other business but healthcare that doesn't try to solicit best practices for free. For free. But no, we just throw people under the bus and we intimidate them. We make them feel stupid. Because I don't know why. I don't know why. But for some reason, as nurses, that's part of some of what we do. I'm asking all of you today to stop. If that's even an iota of you, just stop. Do patients feel safe speaking up? Well, you heard the story this morning. Good grief. The way we treat each other, I don't know why they'd be comfortable speaking up in front of us. But patients do need to feel today. Speak up for safety is what the Joint Commission calls it. All of these things that it's abominable that we had to have the government tell us in healthcare how to treat our patients and how to keep our patients safe. But that's where we are today, and that's okay because we're making it safer, we're making it better. Today we're going to have some tough conversations. We're going to at least demonstrate, at least talk through it. I want to throw this out to you, though. I want to ask you what kind of culture you think you have. And I'm not talking about your whole organization. I don't care if you have a department where you have 8 people working for you. You have 2 people, 1 person working for you. What kind of a culture have you created? And what I think in healthcare, what we do a lot is we have cultures that are very optional. And one of them is even around hand washing. And you just heard that a little bit ago, or you heard that from Freddie's wife, actually. So what does this look like? Better hand washing. We cause 2 million hospital-acquired infections. And some of the original research from the CDC said only about 48% of the time do we even wash our hands. And if we eliminated, remember that waste thing? 10% of those 2 million infections, we'd save 10,000 lives and $3 billion every year in healthcare. Okay, now, what I want to ask you all is, now that you've seen the data, now that you've seen the research, wouldn't your values say, I'm going to always wash my hands? I'm going to always wash my hands. Now, ask me if I've always washed my hands. Of course not. I was too busy taking care of patients. I didn't have time to wash my hands in between all of my patients in the ER. But now that I've seen this, now that I know that we cause CAUTIs, we cause CLAPSIs, can you imagine that we do this? This is where we are today. I believe this in my heart. Lack of hand washing is absolutely reckless behavior. We kill people. We kill people. And at the bottom, I think we're here now. Disciplinary action. I want to tell you 2 stories around this that I hope you'll always remember because they killed me. We have a partner that we worked with on the East Coast, and this is a true story just like a lot of you do. We're really working on their hand washing initiatives. And what they did was made it very, very public. We want everyone to work together. The chief medical officer was one of the initiative champions that day, and she said, if anybody sees me not washing my hands, please respectfully tell me. I want you to have my back. Well, she also had a part-time practice. And one afternoon, she's seeing her patients. True story, could never make this up. Seeing her patients, and she walks in. How many of you have semi-private rooms in your hospitals? She walks. If you don't, you're really lucky if you have all private rooms. But that takes away an excuse. You know, we use semi-private rooms as an excuse. Anyway, she walks into the room, first room, or A bed. Both of her patients were in A and B bed. That's how we talk about patients, A bed, B bed. So she washes her hands, examines the patient, goes around the curtain to B bed, and doesn't wash her hands. Takes out her stethoscope, starts examining the patient. There happens to be an environmental service worker in the bathroom at that moment. The environmental service worker, who had heard about this hand washing thing, said, excuse me, could I talk to you in the hall for just a minute? They walk out in the hall, and the CMO, here's another key word or key thing I want you to know about individual feedback. We have 2 choices. You can either say, excuse me, who are you to give me that feedback, which is what this chief medical officer did, or we can say, wow, thank you so much. I appreciate you bringing that to my attention. Personal choices. The CMO pushed back and said, who are you? I'm in a hurry. Come on. She said, well, I really apologize. She said, but I just wanted to let you know you didn't wash your hands before that second patient. And again, she pushed back and said, excuse me? So the environmental service worker said, do you mind if family members ask you questions? Do you involve family members in their care? She said, absolutely. I pride myself on that. She took off her name badge. And she said, well, I haven't had the chance to meet you yet, but that person lying in the bed is my mother. She said, and a year ago, all this is a true story. She said, a year ago, my father was here. And a year ago, my father got an infection in my hospital, and he died. She said, I would really like to take my mother home, so would you please wash your hands before you take care of her? That's what we need in healthcare today. Then the chief medical officer went out and told everybody just like this, I said we were transparent. We all need to work together as a team. She was absolutely right, and thank you for doing that. Second story, true story, and if this one doesn't kill you, then you're not listening. In 2010, Studer Group won Malcolm Baldrige Award, and if any of you know what goes into Malcolm Baldrige, it's even more so than Magnet. It was incredible, that journey. But we won, and you get to go to Washington, D.C., up with Olivia Pope. Just kidding. If anybody watches Scandal. My daughter got me started on that. I could kill her. Anyway, you get to go to Washington, D.C., and you're in this great big ballroom, and you get this big award, and it's like this hoo-ha. So Quint didn't even go. He picked different, or we had a lottery. I don't know how he did it. I don't remember. But coaches and speakers got to go to pick up the award. So they're sitting at this great big table, and there's another winner that year. They're called Mighty Fine Burger and Fries out of Austin, Texas. They're owned or managed by H&N Management or something along those lines. But a burger joint won the Malcolm Baldrige Award. Literally, true story, at that table, they said, oh, you guys are in healthcare. Wow, it's so nice to meet you all. It's great. You guys know the difference between you and us? We fire people for not washing their hands. Now, what can you get from, what, a little, food poisoning, a little E. coli, big deal. We're down at a central line not washing your hands. If that doesn't hit you a little bit, I just hope you'll think about in terms of how are we going to call each other out. What are we going to do respectfully? We do this at Sarasota Memorial, just hold up our hands. You forgot to wash your hands after that last patient. I'm reminding you because I know you're busy, but I want somebody else to do the same for me. I walk around with foam in my pocket. I just hand it to people. Whatever it takes today, if that were your mother, your father, or Freddie laying there, you would do the same thing. And it killed me to the bone to hear Regina say, I left my husband at the hospital alone. I didn't know you were not supposed to do that. It shouldn't have to be that way. Would you all agree? It should not have to be that way. So these tough conversations, we're going to walk through this fairly quickly. This is much too big of a room to really practice them, but I want to walk through a few examples. The first thing that we want to do anytime you're looking at a tough conversation, you want to ask yourself, why am I doing this? Kind of monitoring my motives. What am I here to get? Just like we showed you earlier, are you here to compete? Are you here just to win? We're going to look at that one. We're going to talk about practice presence, which is basically listening. What does listening look like? One of the key things that I have to work on as a leader all the time is listening. I can literally have your sentence gone, and I'm on the next paragraph when you're talking to me. My kids called me out more than anyone, and I finally really had to figure out how to listen. I had to sit on my hands and just really engage and listen. We're going to practice that for 2 minutes.